of the Lekwangwin people, now known as the Songhees and the Esquimalt nations. And I always raise my hands in honor that I have the absolute privilege to live in this beautiful land because of the First Nations willing to share this land with us. Today we will be discussing the committee's process first for considering representatives for children and youth reports, reviewing 2 of the reports, and receiving an update on the work being done by the office. So our first item on the agenda is committee process for considering representative reports. Just so that the committee members know, the Vice Chair and I have been in conversation on and off, and this matter is open for discussion, but we do have a recommendation that we will be putting in front of you. One of the last spots we finished off at in the last meeting we had was how are we going to deal with reports when it comes to interaction of the ministries and bringing people in. So this discussion was at the end of our May 1st meeting, and I know that seems like a long time ago, but this is an opportunity for us to revisit that right now and make a determination for this coming session. As you know, this committee has not usually asked ministries to appear to respond to a report of the representative. Rather, the committee considers a report and has on occasion requested ministries to appear at a subsequent meeting to provide further information or follow-up on the representative's recommendations. In other words, give us an update. We've done that. The Deputy Chair and I had a discussion about this. I would say it was a lengthy discussion. Would you not? Sure. Yes. And we would like to propose that the committee consider appearance from ministries on a case-by-case basis, and that this approach be formalized by including an explicit agenda item following consideration of each report. So rather than mandating after each, as we deal with each report, that the ministries have to be here, that we as a group make a determination whether that is required, and then we proceed that way. I look to the Deputy Chair for anything he may wish to add.
Oh, if I can, Chair, thank you.
Of course.
Well, just obviously thank you for your leadership on this as well and bringing it forward. I'm not sure what that is. I'm vibrating or something weird happening, but
we're on air.
Yeah, that's right. The feedback that happens. But anyway, I'll just continue on, I guess, while Hansard's trying to figure out what that is. And obviously, it's all around the accountability aspect that we've talked about with this committee. That it's selective, and I know our member from Kelowna Lake Country has brought this up as well. Don't want to speak on his behalf, but I was seeing him on Zoom that it's really important that this committee have the opportunity to ask ministry staff to come in on a case-by-case basis, as we've identified. There will be some reports that I think are self-explanatory. From a committee perspective, we might decide that it's not needed, and where I think it'll be very important where in to address some of those concerns or questions we have on a follow-up basis. So it's obviously something that the Chair and I have talked about that I support as well. Thank you.
I'm now going to open it up to committee members to see if they have any questions about this or suggestions. So this is your opportunity to have a say.
Sounds really good to me.
Okay. I don't see anybody else with their hands up. So what we're going to have happen now is you will get a copy of a motion.
And Norm, I'll send it to you over Zoom so you can see the text.
Just checking the mic. Is it working? Good. Hey, I moved seats.
So it was you.
It was me.
Okay, everybody has the motion before them, and do you have it, Norm? That's great. No, he's thumbs up. So, Aman, would you like to move this?
I move this motion.
Could you please read out the?
You have to read it out.
I move that following the Select Standing Committee on Children and Youth's review of each representative for Children and Youth report, the committee consider whether it wishes to follow up with the appropriate government bodies on the status of the implementation of recommendations contained in that report. And for clarity, this does not apply to representative for Children and Youth reports that do not contain recommendations or provide an update on the status of recommendations.
Okay, do we need a seconder? No. Okay. So, open for discussion? Okay, all in favor? Passes unanimously. Thank you.
Could you sign and give me copies?
So the agenda will be modified to provide an opportunity to consider follow-up on the Right to Thrive report. And we will have that discussion. And then based on our discussion, we will move forward. So I want to thank the members. Obviously, the summer break's been good for us. And next, we will consider the representative's report titled The Right to Thrive, an urgent call to recognize, respect, and nurture two-spirit, trans, non-binary, and other gender-diverse children and youth. You know, they say that sometimes things happen by circumstance or coincidence, but I cannot think of a more timely time for us to be taking a look at your report, and it's a very, very painful time right now. So I'm looking forward to it. Joining us this afternoon, of course, we have Dr. Jennifer Charlesworth, Representative for Children and Youth, Pippa Rowcliffe, Deputy Representative, John Yakilashik, Executive Director, Reviews and Investigations, Dr. Elizabeth Sywick, Executive Director, Stigma and Resilience Among Vulnerable Youth Centre, University of BC. So over to you.
Thank you very much, and it's lovely to be here with all of you again after the summer recess. And thank you very much, Chair, for acknowledging the challenging times we're in and the urgency and the importance of the report that we're going to bring before you today. And I too would like to express my gratitude for being able to do the work on the traditional lands of the Lekwungen people and the Esquimalt Mountain Songhees Nation. And these days, given the nature of the work, I look to the land to support me and hold me well for some of the painful things that we're having to deal with. And we're very fortunate to have Dr. Sywick join us today from UBC. It was an incredible collective effort that she and her team pulled together some incredible research, did some really important outreach and engagement of young people. So we're going to be companions in presenting this. I will talk a little bit about the origin story of the report and some of the key things that we wanted, the reason we became committed to this. Dr. Sywick will speak to some of the findings, the literature, the research, and some of the things that the young people said. And then we'll circle back and we'll talk about the recommendations, and then welcome questions, any and all questions. The other thing I'd like to just acknowledge before we begin is to acknowledge one of our colleagues, Naomi McCormick, back here in the gallery. Naomi was integral to the drafting of this report and is joining us in the gallery today. And my other colleagues will introduce them as we come forward. So, the right to thrive. I'm going to begin by setting the stage. This was released on June 21st, and we knew then that it was an important report to release. We had no idea when we began in 2021, just the way in which the societal views and attitudes and some of the societal pressures that started south of the border but have definitely migrated north. We had no idea how critical this issue would become. And of course, as you noted, it was underlined in a very troubling fashion on September 20th when opponents of gender-affirming respect and care staged protests across the country against gender diverse and trans youth. And if government didn't realize the urgency of this matter before then, they certainly do now. So I'm going to talk about the 3 reasons that we began to investigate this in the first place, and then we'll talk about some of the learnings. So the first reason is really the evidence. We follow the evidence. That's important for us to be paying attention to. And Dr. Saywick will speak to some of the important evidence across other jurisdictions. But we start with, we want young people to thrive. We want them to be able to live full, joyful lives and be able to bring their gifts, their abilities to their communities and to their families. And when Two-Spirit, trans, non-binary, and gender-diverse young people receive the gender-affirming respect, support, and care, they thrive just as much as their cisgendered peers. From a place of safety and belonging, and you know how important belonging is to us, they're able to be authentic and engaged participants in family, school, and community. And this is what we want for all of our kids. Our circle of advisors, which we'll speak to in a few moments, a remarkable group of people that guided us beautifully. They reminded us that too often these young people are cast in a negative light or defined exclusively by their gender identity rather than by the full range of interests, strengths, hopes, aspirations, relationships, needs, and gifts. So first of all, we choose to celebrate the diversity of the young people in our midst. However, when Two-Spirit, trans, non-binary, and gender-diverse young people are not safe and they do not receive the gender-affirming respect, support, and care that they have a right to experience, when they experience stigma, discrimination, threat, and denial of who they are and how they identify, they're more likely to have negative life experiences that escalate the risks of harm. So we were concerned about a pattern of injuries that seemed to be emerging in our critical injury and death reviews. And so I asked our reviews and investigations team, Naomi being a member of that team, to review all the critical injury and death reports we received for this population of young people between 2018 and 2021. And of course, we see a slice, you know that. We see a slice of those young people that are most vulnerable. But the results of that review were not good. And what we found, among other things, was that these young people that became known to us were doing consistently less well on some key measures than their cisgendered peers. Notably, a higher percentage of injury reports were associated with suicidality and self-harm for our Two-Spirit, trans, non-binary, and gender-diverse children and youth who are receiving government services compared to their cis-male and their cis-female counterparts. And this difference isn't small. So 44% of injury reports for this population of young people were associated with suicidality and self-harm. Compared to cis-males, it was just 14% for suicidality and self-harm. And for females, it was 22%. So you can see we're looking at an alarming variance that actually ends up showing up in the literature as well. So I have shared with you some visuals, and I'll just turn to the one of the raindrops. It's just a visual to remind us of who we are thinking about. So there were 198 Two-Spirit, trans, non-binary, and gender-diverse children and youth, and they had experienced a total of 718 injuries, and including 11 deaths during the period in which we did the review. So we try and remind ourselves and center ourselves in the stories of these young people. So the raindrop represents one, each raindrop represents one of these children who experienced at least one critical injury, and the 12 represent children who lost their lives during this period. The results highlight the adversities faced by this group, including that some of these young people experience multiple injuries or multiple critical injuries that come to our attention. And those with the reoccurring injuries or multiple injuries typically identify with multiple support needs. So we often see a confluence of young people who are neurodiverse, they may use substances, or they have mental health concerns and they need supports or treatment for that. So in the report, we included 2 stories of young people, that give you an idea of what they were facing and how desperate they were to receive gender-affirming care. And I'm just going to give a few highlights that I think are important. So one child, we called them Avery, experienced a lot of interconnected challenges, and that is something that comes to our attention. They were diagnosed with autism, actually had to go out of province in order to gain access to an assessment because it was do that privately. But they also had a number of mental health concerns, and their family, while supportive, struggled to meet the needs of this young person. Avery identified as trans and desperately wanted to receive gender-affirming care, which included puberty blockers when they were younger, just entering into their teen years. And that was also around the same time as their first suicide attempt and hospitalization. And they could see into the future, and they hoped to receive testosterone treatment when they were over 16. But they were basically told that their mental health needed to stabilize before they would get gender-affirming health care. This was despite the possibility, as we often see, that the mental health crisis was linked with, if not caused by, the gender dysphoria and onset of puberty that accentuated that disconnection that young people experience between their body and their identity. Avery did eventually receive puberty blockers, and interestingly, the mental health stabilized at that point. There were lots of services involved, but as we often see in this committee, they were inconsistent, inadequate to the child's needs, and often had very long wait lists. And the service providers struggled to provide that knowledgeable, appropriate, and gender-affirming care because in many cases, service providers aren't provided with any kind of training or support to understand how best to do that. And sometimes there were conflicts between the systems. Sadly, Avery passed away by suicide, and before being able to get the full range of gender-affirming care. And it's a really tragic story for this young person. We also shared the story of Robin, who ended up in care of MCFD, born in a small Indigenous community, moved to BC with their mom and 2 siblings. And there were lots of factors within the family of violence, poverty, housing instability, and actually Robin was diagnosed with PTSD, which is quite an extraordinary thing for a young child to experience, to be at that level. Robin and their siblings did come into care, but unfortunately their foster caregivers weren't able to meet their needs, and the child was blamed for the deterioration of the placement as they became more and more disconnected, frustrated, and absent. And MCFD had very little to offer them, and Robin talked about not feeling safe or accepted in the staffed homes that they were in, and felt that the staff didn't understand how to recognize and respect them. And these resources are supposed to be more specialized, but again, in most cases, they had no training or support. For us, we received actually 25 reportable incidents for Robin, which ran from sexualized violence and exploitation, medical injuries due to substance use, and substance-related psychosis. And what's interesting is Robin eventually took matters into their own hands because they didn't feel that they were getting the kind of support that they needed. So they primarily access shelters in the downtown east side because they feel more accepted and safer in there. And they are able to identify as a woman and feel that they are more accepted in that context. So I think about this and I think, how is it that a child feels safer in shelters in the downtown east side than what we have on offer for them? So, at ages when we hope young people will be looking forward to middle school and high school, enjoying time with friends and their interests and whatnot, we are seeing young people that are finding their lives so difficult because they aren't getting the kind of care and respect and affirmation that they need, that they're thinking about suicide, self-harming, use substances to cope, and experiencing mental health crises. So that's the first reason. We followed the data. This is where it took us. The second reason is that this is entirely preventable. When these negative life experiences, when we know better, we can do better. And we know better that when children are valued, nurtured, affirmed, and receive the care and supports they need, their outcomes are similar to their cis counterparts. So they're at no greater risk of experiencing life-altering negative experiences, such as suicidality, when they receive the care and support that every child has a right to receive. That's the key, I think. And it's really the stigma, the discrimination, the shaming, bullying, disconnection, and the lack of care that's contributing to these poorer life outcomes, not the fact that they are two-spirit, trans, gender diverse, or non-binary. So then that's the third reason, and we've been seeing it, that rise of organized hate and intolerance. As I said, it seemed to start in the US, but it's spread to Canada with a virulence that can only be characterized from us as scary. And just to put this in context, in the US, the Trans Legislation Tracker noted more than 550 anti-trans bills introduced in 49 state legislatures in 2023. Thus far, as of June, actually, that was just halfway through the year. And we're obviously not immune here in Canada, and you will be familiar, no doubt, with the situation in New Brunswick and in Saskatchewan. And in Saskatchewan, in New Brunswick, the Premier was willing to trigger an election over the issue. And in Saskatchewan, the Premier is contemplating using the notwithstanding clause to bypass the rights of children to use the pronouns and names that are congruent with their gender identity, and to do so in a safe way. It's beyond alarming, and that's because we know the repercussions on kids. So when these young people experience that kind of hate or that intolerance, that it's really a fundamental denial of who they are and how they operate in the world. And the protests on September 20th were, of course, glaring. And it contradicts the evidence of what we know makes a difference. If you're a young person and you see adults behaving in this way, how do you make sense of that? They're trying to deny your existence and erase your rights. And we know that the exposure to this kind of messaging has a direct impact on the mental health of young people. So I am going to, end with one quote from a young person and then pass it over to Elizabeth to share a little bit about the evidence. So this young person said, "There's a lot of hate where I am. It's very scary for me to leave my house most days. There's a lot of violently transphobic people around me, and it definitely feels like a lot of times, every time I leave my house, I have to protect myself in order to be myself, which is not easy." So I will pass it over to Elizabeth.
Thank you, Jennifer, and good afternoon. It is with gratitude that I'm speaking to you here on the traditional lands of the Lekwungen peoples of the Songhees and Esquimalt Nation. But I would also like to acknowledge that the research that the Research Center of Stigma and Resilience Among Vulnerable Youth Center at UBC in the School of Nursing that I lead is located on the traditional, ancestral, and unceded lands of the Musqueam people, where UBC's Point Grey campus is located, but also to acknowledge the many Indigenous peoples on whose lands our research center engages with young people in health research across BC, across Canada, and actually in other parts of the world. So our team was asked by the representative for children and youth to conduct research that helped inform this report. And so I'll share some brief information about how we did this work and a few of the key findings. I'll also, the detailed report is embedded in the actual Right to Thrive report as an appendix, starting, I think it's on page 80 or thereabouts. So our approach to this work started with 2 focused literature reviews to identify existing research evidence. We drew on expert advice from 2 fabulous librarians, one from UBC and one from Harvard, to guide our searches. I'd like to do a shout out to great librarians. These searches focused on 2 topics. First, the mental health and substance use related care experiences and access to health care generally for trans and non-binary young people. And then second, the experiences and needs of gender diverse youth who have been in government care or are unstably housed. So we focused on Canadian research, BC first, but it was pretty clear, aside from a lot of the research that we did, that we needed to expand to evidence from other provinces as well. And for research about trans and non-binary young people in government care, there's even less published research. So we actually included studies from the United States in addition to Canada. To give you a sense of the scope, we reviewed 310 articles, and we ended up with 45 relevant for our first search around substance use and mental health and access to care, and 30 for the second review looking at youth in care. Then to augment this existing research, so looking at what is out there already, we also tapped 2 Canadian data sources that I am a custodian of that had not yet been analyzed for these specific groups. So the National Canadian Trans Youth Health Survey of 2019, which has more than 1,500 trans and non-binary young people in it, and the 2018 BC Adolescent Health Survey, which is conducted every 5 years by the McCreary Centre Society, which included more than 1,000 gender-diverse students in grades 7 to 12 across BC. Our analyses compare gender-diverse youth in care with cisgender youth in care, and also trans and non-binary youth who had been in care to trans and non-binary youth who had never been in care. That way we had a chance to look at sort of the potential impact of that gender identity and expression in terms of access to services, but also comparing within that group those who had been in care and those who had not. During our literature searches, we found very little information on the experiences of Two-Spirit youth in government care or accessing mental health and substance use services. So with the guidance of our CERAVIC long-standing Two-Spirit advisory group and with Indigenous research associate from McCreary to help run analyses, we also explored data focused on Two-Spirit youth in care compared to their Indigenous peers who had also been in care but were not Two-Spirit. Finally, as Jennifer had already mentioned, we wanted to center the voices and insights of young people and their recommendations, the young people at the heart of this report. So we also interviewed 15 gender-diverse young people from across the province who had experience with government care or mental health and substance use services in BC. These young people, who were ages 16 to 23, 6 of whom were Indigenous and Two-Spirit or other diverse genders, were from up north, the Okanagan, the Fraser Valley, on the island, and the Lower Mainland. And they shared both positive and challenging experiences that they had in navigating services in BC. And a lot of recommendations, a whole lot of recommendations about how to make things better. Their perspectives also reflected in the findings from the literature evidence that we had drawn on and our analyses of the BC and Canadian data about trans and non-binary young people. What these young people described that was supported by the existing research was frequent and distressing misgendering and disrespect at home, in care, and from professionals, and unacceptably high rates of violence and discrimination, even higher than their cisgender peers who are also in government care. They spoke of difficulty accessing supportive, knowledgeable, and culturally safe providers, struggles with really long wait times, or even longer distances to travel to get that needed care if they were in rural areas. But they also described clearly what it looked like when they had an informed and caring healthcare provider or a supportive foster parent, what it felt like when they were seen and affirmed for their identity, how it transformed their lives and their future when they could access culturally embedded supports or counselors. And they had lots of suggestions on how to make it better. Some of their recommendations are simple and really quite practical, but profound. Little things that can make all the difference, demonstrating that they are seen, they're valued, and that their rights are respected. Other suggestions will clearly take time and resources in order to change systems. And Jennifer has laid out recommended actions for the BC government that can lead to those changes. Just as importantly, the young people we interviewed shared their joy in who they were. They told us what they liked about their gender. And across the many different ways that they identified, they used words like freedom and confidence and enjoyment. As one non-binary young person from Metro Vancouver said, "I like the ability to express myself in the most authentic way I can." And our research findings also echoed their stories about how when they are affirmed in their gender identity and expression, which is their right under our BC and Canadian human rights codes, they can transcend the trauma and life challenges that they have faced and truly thrive. Back to you, Jennifer.
Thank you. And thank you very much for speaking in the voices of youth. And that's a key part of the report that we did. And we'd actually wanted to invite youth and some of our circle of advisors here today, but in the climate that we're in, we felt it would just be too unsafe for them. So they're here with us listening in. And I do want to say how fortunate we were to be able to work with Sarovic and Dr. Saywick and a remarkable team that brought a whole other body of knowledge and experience. And combining our efforts, I think, makes for something that's very compelling and evidence-informed. It's also practical, and it's centering young people's voices. And we want to also acknowledge an incredible circle of advisors, community practitioners, researchers, advocates, and academics, 19 of them who worked with us intensively over a number of months in order to bring this to fruition. And so really, you know, we have findings that basically we can do better, that when young people are supported, they do well. But there are many situations in our system as it currently is constructed that they are not getting the kinds of supports that they need. And sadly, there is that growing disinformation that is spooking families, it's spooking service providers. So we felt that we needed to try and tackle that. So with the recommendations that the wisdom of Sarovic, our community advisor, our community advisors, and others, we came up with a number of recommendations. So the first really was more of a pan recommendation: make an urgent public commitment to ensure that the rights of two-spirit, trans, non-binary, and gender-diverse children are upheld. So more specifically, we recommended that the Ministry of Attorney General identify opportunities to enhance legislative and regulatory protections for this population of children and youth to address the disinformation and discrimination and lead the drafting and passage of these protections. We recommended to the Ministry of Health that they take lead responsibility for the ongoing design and implementation of a cross-government commitment to gender-affirming care, by developing a cross-ministry process and also by forming a set of principles that will guide a coordinated approach across ministries as they create action plans within their specific areas for gender-affirming care. And what we felt was that there was benefit of those different ministries coming together to operate from a shared set of principles, and so that they could each complement each other's work. We recommended that the Ministries of Health, Education, and Mental Health and Addictions establish action plans and timelines for the incorporation of these principles, and that Mental Health and Addiction specifically review the mental health and substance use needs of this population of children, youth, and their families to ensure that the next revision of the action plan, A Pathway to Hope, incorporates new plans, guidance, and protocols. Just as an aside, the Pathway to Hope is silent on this population. And then we also recommended a number of things to the Ministry of Children and Family Development, given that we were learning a lot about those young people who are in care or receiving services. And we asked the ministry to establish an action plan and timelines for the incorporation, again, of the jointly created principles, but move into procurement, policies, training protocols, practice guidelines, and parent and family support services across all of their service lines to ensure their staff feel knowledgeable and capable in providing gender-affirming care. And that would also translate to when they're procuring services from residential service providers, or when they're supporting foster caregivers, ensuring that their procurement practices, their training protocols ensure that those people are able to provide the care that the young people need. We also suggested that the ministry create a minimum of 2 provincial positions to provide specialized practice consultation very practical. They have practice consultants in MCFD along various service lines. This would be an opportunity to identify several people who could be coaches and mentors and supporters of other staff who are trying to support these young people in a good way. We also recommended that the ministry provide foster parents and caregivers with the supports and training they need to provide gender-affirming care for the children and youth in their care, and that the ministry ensure all contracts for group homes include requirements for policies specific to gender-affirming care, and ensure that staff have the necessary training. So just in closing, and then we welcome your questions, I have to say, and this is I have to say I've been disappointed because I thought that there would be more action. While we set timelines for our recommendations that were into the future, it seems to me that we don't have the sort of overt kind of support until very recently that I would hope for these young people. And I think young people are listening and trying to pay attention to, is there anybody that sees us? So I really encourage government, and in fact wrote a letter to the concerned ministers and the Premier to express my dismay that it has not been more proactive. So my hope is that this will, that we can stand together and also stand apart from some other jurisdictions that are eroding the rights of two-spirit, trans, non-binary, and gender-diverse young people, because they have a right to be safe, nurtured, and protected. It's actually enshrined in the UN Convention on the Rights of the Child, but unfortunately the world is getting increasingly hostile to these young people. So I really like to thank Dr. Saywick and their amazing team and the wonderful circle of advisors, as well as our staff that are involved in this. And we would be pleased to take questions from you.
Thank you very much to both of you for the presentation and the work you did. And this is a work that engages a lot of heart and brings lots of emotions to the front. And I want to acknowledge that up front. So thank you for your work. And now over to committee members for questions, comments. Okay, MLA Kirkpatrick.
Thank you, Madam Chair. I'd just like to reiterate also what our chair just said, and just appreciation for the work that you've done. It really saddens me that a young person would not feel safe in this building, which is supposed to be representative of all British Columbians, regardless of who they are. So I hope that we can create an environment where those young people would feel comfortable coming here. So that really struck me when you said that. And if they are listening, my apologies, that we should be in a climate where that is the case. I'm looking for perhaps an example. Well, thank you very much for all of this. With the recommendation that the Attorney General examine the need for regulatory legislative changes, can you, and I apologize if it is set out more in the body of the report, but could you give me an example of what that might look like?
Mm-hmm. Thank you. Well, one of the things is to make sure that when we've got like the human rights instruments that we have, that it's very clearly articulated that the rights of trans, two-spirit, non-binary, gender-diverse young people are protected within that, and also taking a look at situations in which well, for example, we'll take our own legislation. Right now, as you know from having reviewed our legislation, there are a number of areas in which we have responsibility, and the rights of children, two-spirit, trans, non-binary, and gender-diverse young people are not listed in the areas of which over which we have some responsibility and accountability. So one of the recommendations was, and it came through in your final report, was that be added to the RCY Act specifically, that we would ensure that we had some regulatory or legislative authority to ensure that the services across the board were being provided, much as we do for mental health and addictions. So those would be two key ones, and I'm looking to my colleagues, others that you can think of. No?
Thank you. And thanks, Madam Chair.
Well, thank you very much. And as you said, these are interesting times and challenging times. And the amount of misinformation out there is scary for us. Never mind a very, very vulnerable group. So, thank you very much for that. And seeing that members have no questions on the report, now we're going to have that discussion we talked about earlier to see if members would like to see further follow-up at this stage, and if so, what that would look like for them. And, I want us to be, as we're considering this, take a look at what will move us forward and what will help, rather than for the sake of it, right? So that's all I'm going to say. MLA Babchuk.
Thank you, and thank you very much for this. In regards to the motion that we just passed there, I'd certainly like to hear from some of these ministries. The report came out in June of 2023, and although I recognize the disappointment in not moving forward, I'm not actually, I have no knowledge of if it is or not. Are they working on it? Or I know you've put in timelines that you would love to see. Are those timelines realistic timelines? So I would love to be able to have a conversation or be able to bring ministries back in just to have that conversation about what they are looking at. I believe that the ministries themselves, this is on their radar. I believe that to my core. But I have no knowledge right now of where they are in any of this process. So it would be nice to hear from them.
Did you want to identify the ministries you would like to hear from? And, we could add so many, as I just heard the vice chair say, but I think let's be strategic and targeted as to which ministries we need to hear back from on this. Just think about it. It's a question I put out there.
I need to think about it because some of these recommendations that are in here actually are specifically mandated to specific ministries. So I'm not sure that we could expect a different minister to speak to some of these or a cross-committee.
We can have more than one ministry come, but we just still need to narrow it down.
Yes.
Right? Okay.
Thank you.
So people think about that as we're having this part of the discussion. MLA Singh?
So just further, thank you for that. Further to that, I think instead of just exactly my point, but I know the report was tabled in June. This summer was quite challenging for the government, as we all know. But before bringing them back, I think maybe we should have a preliminary step where we actually ask the ministries: is this a timeline that is this a timeline which is workable for you, and what is happening, and before we bring them in. But I mean, all these different recommendations have different timelines, so I think we're going to be presumably be having a few different meetings, so I think they can be brought in at different times. But I think the first step is to ask.
I have a suggestion to make, that rather than asking them about the timelines at this stage, it might be good for us to hear their perspective, their context, right? And with that will come the kind of information you're looking for. I'm just throwing that out there, but, like everybody else. So next. Oh, sorry. Did you have a comment, Jennifer?
I did. Just so for your information, when we do the recommendations, we bring a draft to the ministries and then get their feedback, and we have timelines that we set out, but then they give us feedback on the timelines. So these were the timelines that they said was feasible for them. Stretch, obviously, is feasible for them. So I think that's one consideration. The other thing is that we meet with them after the report is released in order to go through to make sure that they understand the intent or the spirit of the recommendations, because sometimes they could come back and say, well, we can't do it quite that way, but we could do it this way. I'm fine with that, as long as the spirit and the intent is followed up. And then they have 6 months to prepare an action plan. So in terms of timing, then that would be looking at November, December, when they would be starting to have their action plans. So that's something for you to consider. And I may well have misguided. It's not that I expected these recommendations to be completed by now, but I was really hoping that there would be a statement to say, this is important, we're going to follow through. That's the thing that I think our young people need to hear, is that they're seen, they're heard, and that action will be taken more than words. So I just wanted to make sure that that was clear. I wasn't expecting that these would be done by now, of course.
Thank you, and that's what I was sitting here thinking, that there's lots of steps that have to happen between you and the ministries before they actually come here, if we still need them by that stage. And I don't see that happening before the springtime, because as you said, if you're looking at October, November, when you're going to meet with them and start looking at action plans with them, then it makes sense that we should get some kind of a response later. I do want to say that, not just from myself, but I think the Premier, and I would say the whole House, except for about maybe 5 people, made it very, very clear and very, very public that we are standing with these very vulnerable kids, and they are not alone. And I wanted to get that on the record, that that is there. And I've been here not a long time compared to some of my colleagues, but it is the first time I've seen people from both sides of the House rise in the way that they did, even though it was during question period. But it was significant for me, and I rarely get teary, but I can tell you at that stage I did, because it sent a huge, huge message that every child counts. Every child matters.
Yes.
Thank you.
Thank you.
So, Mike?
So just a couple of things as we're trying to work through this. First of all, I think you identified obviously a huge issue. I'd probably argue there's only 2 people. We don't have to start mentioning names. There's only 2 people that really I think we have to be struggling with this, and it's unfortunate we can't make room on the committee sometimes. I was just saying to my colleague here, there's 2 people in the House that need to be hearing this stuff, and we need to be talking about it more because, as my colleague said, of any place that should be safe to have the discussions and for people to be welcomed, it's in this building. And that should then send the message that we're trying to get out in the entire province. Just wanted to make sure I talked about that. But I think on a process, when we're talking about the following up, can I recommend, I'm not sure, maybe if Karn can advise us here, but there's multiple reports. There's lots of things today. We're going to have a strategy when we talk about these follow-ups, because some of them as we've heard, we might not want to talk about this maybe until January, February. I'm just throwing that out there because we have to give ministries time to really absorb it. There's different timelines on implementation. Some things, as I think we can all recognize, and I know that you will agree, some things can be implemented very quickly and easily. Other things have full, well-intentioned ministry staff that we know can take a bit of time. But the whole purpose of this is on the accountability aspect. If it's going to take time, we want to ask, okay, you've agreed to this. What is the timeline? What can we expect? But again, in all fairness, we need to have that, let the process roll out a little bit. As eager as we might want to be, I think we all agree that government doesn't move as quickly as sometimes we'd expect it to. And so I think it's just a respect of the ministries.
Yeah.
And then I just wanted to add to that because there'll be multiple, and there's some other reports in the past that we might want to talk to, there might be a time that we might actually want to sit down and say, okay, instead of having a ministry come in here on one issue, we can kind of bundle it and say, we've got 3 different reports. I'm just throwing that out there as an example. 3 different reports, a group of questions, come prepared because here's what our questions are going to be and here's the timeline we're looking for. So we're new to this. I'm happy we're going in the right direction, but there'll be some, I think, learning curves as we're trying to maneuver through it.
Thank you for that, and you're absolutely right. But it would be premature for us to start meeting, asking for the ministries to come when they haven't even had a chance to sit down with Jennifer and her team and try to work a lot of this stuff out. So I agree, and I think this, knowing that we will want to have some follow-up at some time, we will park it on the side and we will come back to it at a subsequent meeting. And that works. Okay, so now we're going to take a 5-minute, I'm going to thank the presenters and thank you for this report and coming to share this with us. You're not leaving, I know, because you have a few more reports, but I did want to thank your team that worked on this for the work you've done. And we're going to take a 5-minute recess and then we'll go on to the next report. To order. We are now going to be considering the representative's annual report and service plan. Joining us today for this segment is Dr. Jennifer Charlesworth, our representative for Children and Youth, Samantha Coker, and Pippa Rowcliffe. Over to you.
Thank you very much. Just before we go into this, I just wanted to acknowledge that I got teary yesterday as well when I saw the way in which the House erupted and supported. And I was just saying to Dr. Saywick that I'll make sure that the clips of the way in which the solidarity gets shared out, because I think young people need to see that. So thank you very much for that and for raising it. So we are moving on to the annual report and service plan, statutorily required to be submitted by September 30th of every year. So you're getting it hot off the press. And this covers, it's always awkward, it covers the 22-23 fiscal year, so up to March 31st. So there's obviously lots of things that you already know has happened since then, but nonetheless, it covers that period up to March. And then also looks ahead to what we're going to be doing going forward. And I think the last year was an important one for us, and our annual report and service plan, I hope, reflects that. It marked the end of my first term as representative and my 46th year in the child and youth serving sector. I am very fortunate. 46 years, yeah. I was just a baby. And it's my deepest honor to continue to serve as the representative and to do this work alongside an amazing RCY team. In fact, we gathered together last week in person for 2 days up in Cowichan Lake Education Center, and I continue to just be in such awe of the people who choose to come to the RCY and bring their experience, their passion, and their commitment to our team. And of course, we're very fortunate, as was reflected by the partnership that you witnessed with Dr. Saywick. We've got some incredible academic partners, service delivery colleagues, and of course the First Nations, Métis and urban Indigenous leadership, as well as this committee. So I'm now in my second term as of Sunday, and looking forward to what lies ahead. So one of the things, of course, is that what we want is for all children to feel safe, belonged, and to have the opportunity to thrive. And as we think about this, we have a pretty dynamic context within which we're working, and we're constantly trying to figure out how best to manage that. So just to give you a sense of some of those contextual factors that are outlined in the annual report, of course, the most important is their federal and provincial legislation reasserting First Nations, Métis and Inuit communities' inherent rights to manage their own child welfare. And that's prompted us to focus on how we best be of service or assistance during that transformation and to envision what our role might look like, because it is going to continue to change. And of course, what's important to us is relationships, so really building and strengthening the relationships with leadership, obviously, First Nations leadership, Indigenous Child and Family Service agencies, but also in Métis Nation BC, but also with local communities, Gwasala-Nakwada, Simpk, Carrier-Sakani, those other groups that are saying at Cowichan tribes, they are doing some really exciting work. So figuring out how can we be in relationship and support of that. The other thing that's been significant contextually this year is that we've really reached out to our academic partners. Obviously, UBC Cervic is an example of that, but also Simon Fraser University's Children's Health Policy Centre, University of Victoria's Canadian Institute for Substance Use Research, the McCreary Centre Society, in with Forward. And in fact, we have relationships with all 6 public universities in BC, and they are working with us on various niche projects to make sure that we've got good, strong evidence and research and tap into their expertise. We are We are relatively big. We think we're the second largest advocates office in the country, but we are still only, we're still small given the scope of things that we're dealing with. So these research partnerships are important. And they also bring in their own networks of support so we can kind of bridge and connect out with a broader group. The other thing is that it's, we've got, as you noted through the Right to Thrive, we've got some challenging contexts that we're all dealing with, the misinformation, the disinformation, the polarization of views and opinions, and the kind of ramping up of discrimination and stigma and whatnot. So constantly trying to figure that out, and having to be mindful of how that influences our own practice and how to keep folks safe. So lots of contextual changes, and of course, if we take it down to the lives of the families, we have the, and young people, we have the ongoing toxic drug crisis, we have the cost of living, housing, and housing challenges, et cetera, all those things that you are dealing with and trying very hard to deal with this complexity within the roles that you carry. So that's kind of the context, and it does create some significant stressors for children. And I think what we've tried to do and reflect in the annual report is that we are trying very hard to have a very clear focus. We can't do it all, so we're identifying those things that we think will be the greatest benefit for children in this time and that are the vexing social challenges that we're all facing and where we think we can have some make a difference right now. But of course, we're doing that in a public face. We also have the quiet conversations. We've got some really good relationships right now so that we can have conversations with the decision makers, with the service providers, behind the scenes. Not everything needs to come to a public report. A lot of things can be done behind the scenes, and in fact, much more quickly than it takes for us to produce a public report. So I think we've been able to influence case and program planning, policy, practice, and resource allocation. And in fact, even this morning, I was having a wonderful conversation. It was like, this could be quite a significant public report, but there's already momentum. It's like, then let's go with that momentum. We don't need to make everything a big deal. So we've moved forward in a good way. But the other thing you'll see is some frustration. As you know, we brought forward our Advocating for Change report, and there is good progress in some areas and not so good progress or very little progress in other areas. So what we're continuing to do as we move forward is think about how is it that we can even be more impactful or have more of those conversations with government. As I shared with you earlier, we do have lots of conversations before a report comes out to the public. It's like, here's our findings, here are the recommendations we're thinking of. Not that they change our recommendations, that they have the authority to change the recommendations, but we have a responsibility to hear from them as to what's going to be helpful or not helpful, or what are the timelines that are important, et cetera, et cetera. And then carrying on with the action plans, the ongoing reviews, and trying to make sure that movement takes place. So we're changing our practice much as we're asking government to change their practice. I do want to say the other thing that comes forward in this annual report is you will see that the data, as you may be aware, if you've been with the committee for a while, we were seeing a significant increase in our reportables or our critical injury and death reports. It's actually stabilized this year. We're not entirely sure why. We think that there's some, we think that there are some challenges that we're noticing that staff are in the ministry and the agencies are having they're just so short-staffed that it is hard to complete the reportables. But I'm hoping too that it's an indication that we've kind of hit the peak of the reportables. Having said that, the health authorities still haven't come online. They're still not doing their statutory responsibility, fulfilling their statutory responsibilities to submit reportables to us. So that's going to be a big job this year. The other thing you'll note is that our advocacy numbers have gone down a wee bit. We've actually had a decline over the last couple of years. It hasn't come back to pre-COVID numbers. And I think there's a couple of things going on there. One is it's not reduced our workload, frankly, because of the complexity. When you don't have, when there aren't staff and when there aren't resources and the system is really stretched, it does add to the complexity of trying to make sure that kids get what they need. So our advocates are spending longer periods of time doing the advocacy. The other thing that it reflects is that we haven't been out and about as much as we need to, and, you know, people have to know about us in order to be able to move forward. So one of the exciting things is in Sam's team, we've just hired, we've repurposed, we've reworked with our FTEs, and we have 3 brand new youth and community engagement coordinators, outstanding individuals. We're so fortunate that they've come to join us, and so we'll be ramping up our outreach and engagement. So I'm imagining that our numbers will start to increase again. But basically, it's kind of leveled off this last year. The other thing I'll just mention is as we look forward, you'll see a number of things that are identified here that are coming forward. One is our Keeping Families Safely Together, which is, we've been engaged in this conversation for quite some time, and we'll be bringing forward a discussion paper. But basically, what we want to see is how can we prevent children from coming into care in the first place? And what kinds of supports can be provided to families, especially families that have vulnerabilities, parental mental health and substance use, immigrant and refugee. There's a number of things there. So that will be coming forward. We will have a child participation and rights report coming forward as well. It's taking a look at meaningful participation of children in family law and Child, Family and Community Services Act proceedings. I'm delighted to say that, although it's not covered in the report because of the timing, but we had a gathering of 240 people that came together, everybody from the Chief Justice on his last week of work. Robert Bowman joined us, other judiciary lawyers, mediators, parenting coordinators, social workers, counselors, and 82 young people that contributed their perspectives on how to ensure that their voices were heard, to make better decisions, and to uphold their rights. And again, you know, these are things that would, if done well, it means that these young people can avoid, and their families can avoid, the legal proceedings that sometimes go on for years. It costs a lot, but obviously to the taxpayer, but more importantly, it costs a lot to the lives of children and families. So that's coming forward. And we've got another report that's going to be key, what we call Systems Failing Girls. We don't know what the title is going to be, but that's taking a look at our young girls who have very complex constellation of needs, and how is it to serve that kind of complexity, and following up on the missing work that we did and presented to this committee as well. The other thing that will be occupying a significant amount of our time and energy this year is an investigation and systemic review, and I'll be covering that after we talk about the annual review. And that is, it was unprecedented actually that I publicly announced that we would be undertaking an investigation, but this was following the tragic death of the little boy in the Fraser Valley, the little 11-year-old who was in foster care. Again, I'll speak to that, but we've basically been urged by First Nations leadership to do the investigation, but also take a look at the factors, the systemic factors that need to be illuminated. So we will be doing that. So the other thing is that in terms of where we go forward, we will continue to do some monitoring of other reports. So it's very interesting to hear the ways in which you want to bring forward or to kind of ask ministries to come forward. One of the key areas I wanted to flag is that At a Crossroads, which was the report on fiscal discrimination, that is definitely getting more and more attention, not only here, but also in other jurisdictions. And there is discrepancy because of the rising federal funding, which has resulted in some children that are on reserve able to access more resources through the agencies that are supporting them, but less so for children living off reserve. So we do think that that is critical. So we will be attending to that. A few other areas that we're going to be focusing in on, they'll show up in the systemic review to some extent or in other ways that we work, but just to give you a sense of our top priorities, certainly the children and youth with special needs. We are working now on a report that will be taking, we've gone back to the families that have been involved with us and other reports to ask what is their experience. That will come forward. We'll do an accountability report in 2024 as well. So CYSN is important. The other areas are, of course, the toxic drug supply. We'll be doing convening, bringing the experts together. You know, we know that there's a challenge. Doesn't need another report from me saying we need to have more resources. It's just like, how do we tackle this? So we will be doing convening in collaboration with the WASC Center for Dialogue. You're bringing experts, pediatricians, addiction medicine specialists, coroner, provincial health officer, and young people, and those who really understand the services to try and figure out how do we deal with this intractable social issue. And we will be dealing with mental health and substance use, mental health services as well, continuing our work there in terms of Indigenous mental health. Some wonderful work has been done on youth transitioning to adulthood, so continuing to monitor and support that. And then residential services as well. We'll touch on that when we do our investigation and systemic review, but we will have to come back to that in terms of the specialized services because they're not meeting the needs of our kiddos. So those are a couple of the highlights in terms of what we are, what is reflected in there in terms of our core activity as well as our public facing activity and some of those priority areas. So I would be delighted for any kinds of questions that you have, any ways that I can be of help to make sure that you understand some of the things that we're doing or some of the things you'd like us to do. And then we can come back maybe at the end to talk about the key performance indicators and how to measure our progress.
Thank you, and I have Norm. He's got a question or a comment.
Thank you, Madam Chair, and thank you, Jennifer. Really appreciate your report and the staff. Also appreciate having a tour of your facilities and meeting some of the people in the spring. That was very educational, so I appreciate that as well. We're in the appreciation mode. Also appreciate the report identifying clearly what you're to be held accountable for and not held accountable for, which is some of my comments from last year's report where we had some discussion on that. I think you gave it a full mile on that one, so thank you for that. Two questions came out of the report, and you actually covered both in the comments. One is in the report, and then you talk about, and I'll just say here, that you've recently taken the unprecedented step of announcing that the RCY will investigate the life circumstances and events leading up to the death of an 11-year-old boy in that situation. So my first question is, why is it unprecedented? Well, how come we don't have more of this? And the second question has to do, later on you talk about, and you did in your comments, the increase in federal funding and the discrepancy. So my question to you on that is, who is the minister responsible to lobby to the finance minister to make sure they have the funds necessary to remove the discrepancy? Is it the finance minister directly? Is it children and youth? Is it Aboriginal? Who makes the argument? Because later on in this meeting, I would propose that we invite them to appear so that we can make sure they know how serious we are about fixing the discrepancy so they can have some power in their genes to go and talk to the finance minister about this issue. I'm not sure if the rest of the committee would support getting that minister to the table, but at least I would like to know who the minister is so I can propose that to the committee for their consideration. So there's my two questions. Thank you very much. I'll go back on mute.
Thank you very much, Norm. And wonderful questions, thank you. So unprecedented. So what we've typically done around our investigations is, and just to give you a sense of the sequence, we get a reportable circumstance, we take a look at that. In fact, every month we meet as a leadership team with our investigative analysts. We go through the hundreds of reports and we identify those that we think we need to either refer to advocacy, bring forward as a case of concern to the ministry or the agency to act on it, or we put it forward to a comprehensive review. And then that is basically to help me understand, is this something we should take to investigation? And some we take to full investigation, but we do that internally. We don't publicly announce. It's done internally, and then we release our report. So Sky and Sky's legacy, that was done entirely. The ministry knew we were doing it, the coroner knew we were doing it, but we were doing it and there was no sort of public pronouncement of that. So the reason it's unprecedented is that before I even did a comprehensive review, I said, we have got to investigate this and we will be held accountable. I put a time frame, all those kinds of things. So that was what was unprecedented about it, is to put it forward in a public context. And there were a few things that I was considering at that point. There was a lot of back and forth with the First Nations Leadership Council, particularly who felt strongly that we needed to do something. There was obviously calls for a public inquiry. Many people don't know that we have significant powers, so they were looking for a public inquiry. And I felt that it was in the best interests for this family that we put our oar in the water, basically, and say, we're going to do this. And rest assured, we will use our authority in order to do this in a good way. Part of the consideration there too was that I think we can do a really good job because we've got those relationships, and we also understand that harm could be caused if it's not done in a good way. So that's a very long-winded answer to your great question, but that was what was unprecedented. We've just never announced that specifically we're doing an investigation on X child before. And then the second one, fiscal discrimination, and I look to Sam if you want to speak in a little bit more. But the fiscal discrimination, essentially, that is the Ministry of Children and Family Development. So it would be MCFD going forward to the True Treasury Board and the Minister of Finance to say we need these kinds of resources in order to provide equitable access to services and supports for kids that are living off reserve. Anything you want to add?
Yes, sorry. Thank you for the opportunity. I just wanted to add in a part of the unprecedented, just in my own mind, is as far as Jennifer's terms go, she's been very clear that she would never want to announce an investigation without speaking to family first, and in this case, announce that publicly before we could speak to family. So I feel like that was unprecedented in regards to how Jennifer wants to do the work at RCY. In regards to the second question, I wrote down it's all of those guys because I feel like I think it is the responsibility of the Ministry of Children and Family Development. But if you look at the Minister for Indigenous Relations and Reconciliation, if we're talking about reconciliation, that would be a reconciliatory act to ensure that the inequities for kids living off reserve aren't going to continue to rise.
Thank you very much. And so, seeing no other questions, oh, we have one, Mike.
Well, I was waiting to see, but not so much a question, more than a comment, and also just to echo my colleagues now as well with your thanks for the work you do. Congratulations on another term, if we want to call it that. I know you like to use the terminology of paddling together. I don't want to sound like a broken record, but it's my opportunity just to remind, I think, all of us, paddling together is fine if it was only one boat. I think the province is quite diverse, and being, aside from my colleague from Kelowna, I mean, I'm one of the only rural people here, and being incumbent on me to remind everybody the diversity, the difference. Well, I guess. I look at Vancouver Island as, okay, I take that point and back. But I think we look at the diversity, the challenges, and I know you know this, but I think it's incumbent on us to always identify and remind each other that because of that, it's sometimes hard to paddle together when we aren't together. You know, we need to recognize some of these diverse challenges in rural and remote, whether it's Indigenous or not. A child is a child. They experience, unfortunately, different but same issues, and deserve the same resources and opportunities. And that doesn't happen. And so I think it's important, not only with your service plan, but just reminding us as we move through the committee and as you do your work, that even though we acknowledge we want to treat everybody the same, we know we can't, in the sense that because of those resources, but we should always be striving to try. And so just wanted to make sure we had the opportunity to stress that, especially with the work that you do. Thank you.
Yeah, thank you very
Thank you,
much.
Mike.
Yeah, and thank you for that reminder. It is very important. In fact, this morning we were going through the reportables, and one of the things that we're seeing, which causes us a lot of concern, is how many children are having to be removed from their community in order to access services. So going into Prince George or Kamloops or down to the Lower Mainland or to Victoria, in order to gain access to the basic services, either a safe home or a home that has some specialty, or access to the kinds of specialized services. And we're actually seeing an increase in the number of children that are having to leave their home community, which is just like, we know that that's not right, because then you're getting separated from family and community and your interests and your school and things like that. But the lack of services that are in many of our rural and remote communities is definitely getting worse. And you'll hear a little bit later, we'll talk about one of the areas that will come up through the systemic review is our workplace challenges, the workforce challenges, and just the lack of staff in many areas. So even with good intentions and desires to be able to provide services, it's just not feasible. So I really appreciate the reminder. Keep coming back with that reminder because it is really important, and it is actually something that we're seeing quite a bit of certain communities just really, really struggling. Or there's no staff. There are 9 ministry offices that have no staff, and I think 12 that have less than 50%. So that has the ripple effects out for sure.
Thank you, Jennifer, and thanks to your whole. Thank you, Jennifer, and thanks to your whole team. I didn't remember to hit this. So we're now going to take a 5-minute recess, and then we're going to come back and carry on with the next segment. This is like a serial, right? investigative?
Okay.
Okay.
Just want to make sure we're on the air.
We are on the air. Okay. This segment is the update on the representatives' investigative and review work. So over to you.
Thank you. We are motoring through. So I wanted to, as mentioned, we are doing an investigation into the circumstances that led to the torture and death of a little boy in the Fraser Valley. And of course, I'm not going to share details specific to the case with you, but I wanted to share with you what our process is going to be, and also that we're tying this into a systemic review. And the reason for that is I want you to have confidence that we're proceeding in a good way, and I think that there's important transparency as we go through this, and I'm happy to come back if the committee wishes to kind of provide some updates at 3-6 months. And also to invite you into some questions that you are carrying that you would like us to be paying attention to with respect to the systemic review. So in the material that I circulated, it starts with the cedar boughs. We often bring cedar into our work, it being so important to the Coast Salish peoples. And just wanted to provide a little bit of context, first of all, in terms of our statutory authority. So as you know, we have a mandate for investigations. If we believe that it's as a result of the services that were or were not provided, were contributing factors to the injury or death. I have chosen to only investigate when a child dies, not with injuries. The reason for that is that I'm very mindful that if a child survives their injury, that this is a record that they would look back on perhaps, or that others would know about them, and that could cause further trauma. So I'm very specific to investigations only in the case of deaths. And as you probably know, we have pretty significant powers to compel participation and disclosure. So, people basically get like a letter, and it's not discretionary that they participate. But obviously, in these kinds of sensitive situations, and particularly because family members would be involved, we would hope to do it without kind of a strong arm, so to speak. But nonetheless, it is important that we fulfill our responsibility and get kind of 360 information. The other thing that we're empowered with our statutory authority is to create multidisciplinary teams. We've chosen to refer to that as circles of advisors. And in this case, we will probably have several different circles of advisors to bring in different expertise. Obviously, a very, very significant one is having a strong Indigenous presence in those circles of advisors, but we have the authority to do that. We also have the opportunity to, in the course of the review, share information with public bodies, and I have undertaken that if there's information that comes to light in the process of doing this investigation where I think some immediate action can be taken, or I have some concerns, that I would bring that forward to the relevant public body. And of course, we have a responsibility to issue a public report. The other thing is that I have authority to do what's called systemic reports and reviews, and that's really on any area that I think is pertinent to the well-being of children and youth. So we have pretty strong statutory authority, in other words, and we will be drawing on all of them as we go forward. The other thing, thinking about the considerations is, and this is something that we are, as a leadership team, very, very mindful of, is we don't want to cause more harm. And I'll tell you, and there's a few communities where there has been so much loss and so much trauma that we've actually chosen to go and do comprehensive reviews and have the quiet conversations than do a public-facing investigation, because we felt strongly that if we did a public-facing investigation, it would actually it would resurface the trauma. So it's very important to us that we think about that. And we also, in this situation, we've got to pay attention to the fact that we are in a changing context around decision-making. and jurisdiction. So, and there will be things that will come to light through this review that will address that issue of jurisdiction. And interestingly, just as an aside, we have met with the First Nations Leadership Council and with the Indigenous Child and Family Service agencies as two places to start. And they are very, very keen and urged us, first of all, to do a systemic review, but also urged us to illuminate the kinds of things that they need to be mindful of as jurisdiction unfolds, because they want to do that well, of course. The other consideration for us is that we're a rights-based organization, so how do we uphold the rights, and of course, how do we uphold DRIPA, which will change our practice from what we've done before, because DRIPA is now in force. And then the other thing is how, and this will, you'll appreciate this, Norm, how is it that we actually make a difference through the work that we're doing? And make sure that there's actually something, a contribution that will enhance practice, policy, legislation, or our broader systems. So those are the things we're wrestling with. So in doing that, we kind of thought, well, what could we achieve? So we took a look at how can we help those children and families that were directly impacted. And on that front, I want you to be aware that we are very mindful of the children who are surviving. We have asked for and received briefings. Our advocates are attached because we want to make sure that there is no further kind of risk to those young people and that decisions are being made in a good way. But also, you know, thinking into our investigation, how is it that we can do this to support those families and the communities and the nations that are involved, and then cascading out to what can be learned from this story. Sadly, it is not an outlier story. There are other situations stories we carry that have similar kinds of characteristics. And so we're trying to figure out how do we have that kind of impact on all those levels, the kids that are still alive, the communities, the nations, family members, and broader out to all children in care. So we considered a couple of possibilities. One was we do a single story. That's very familiar to us. One, we do an aggregate review. One that we've been doing aggregate reviews quite a bit. We bring multiple stories together. Doesn't have the same sort of level or depth as a single story. Or we do a hybrid. We've actually decided to do a hybrid, which is take the single story of this little boy and his family, and that illuminates the bigger systemic issues, and we twin the investigation with a systemic review. We've never done that before, so we're figuring this one out, but I think it's the right thing to do, and wanted you to be aware of where this is going. And again, any kind of feedback in terms of the things that you see are important for us to pay attention to. So what that translates to is that we will be doing an investigation, taking a look at the family and children's stories and experiences over time, over their lifespan. We go full lifespan, whereas when the ministry does its review, it's taking a look at a very circumscribed period of time, not the whole journey for that family. So we'll be doing that. We'll be taking a look at everything from practices and policies and the structures, funding, the whole gamut with respect to the investigation. And then we kind of take a step back and say, how is this child's experience similar to others? We are carrying 4 other stories right now. In fact, we can't move forward on investigations on several of those stories because they're still caught up in the criminal proceedings. Charges haven't been laid. It could be years before we're able to move forward. But we've already done the comprehensive reviews, the very in-depth reviews, and we think these stories are important to weave in as well. So we'll be bringing in these other stories, and then we'll be taking a look at a number of areas for systemic review. So I have a little visual with at the end there. It's number of bubbles around this children's story. So this is how it's going to look. We've got, as I mentioned earlier, we've completed the comprehensive review of this little boy's situation. It's about 80 pages long. It's a very significant and very heartbreaking work. But when we do our comprehensive reviews, we haven't yet spoken to family members. We haven't yet spoken to service providers. It's entirely based on documentation. But it's like the first stage of an investigative exercise. It's like, what should we be looking for and who should we be talking to? So we're there now and scoping out the investigation of the interviews. I suspect that there will be many people interviewed. But in these pods around, it indicates what that comprehensive review has illuminated thus far with respect to systemic issues. So I'll just quickly go through them. Clearly, jurisdiction and transitional decision-making. So, how do decisions get made for Indigenous children in terms of, where they live and who they live with, and how does that look, especially as we are moving towards resumption of jurisdiction. What kinds of services are provided to families when they're struggling, or to caregivers when they step up, so be they foster caregivers or whatever. So what are the kinds of supports that ensure that that child is cared for in a good way? We're definitely seeing the importance of taking a look at children and youth with special needs and the kinds of supports that are provided there, their complex needs. The other thing is increasingly we're seeing situations in which, and the ministry is moving more towards doing what's called out of care. So a child doesn't come into care, but there's a placement for them with either extended family or with known adults. And interesting, Mike, the situation that you referred to would be one of those, perhaps. But we also see situations across our stories where it's like the child is being cared for by an auntie or an uncle or grandparent and whatnot, but then it's like there's no services and supports to enable them to be successful. And these children still have lived with trauma or abuse or the kinds of things that have brought them into this state, and those families need some help as well. It's always been my concern that those families be supported to be successful, even though they're not formally like a foster caregiver or whatever. And some movement with respect to payment and equalization of payment is very good, but nonetheless, some of these kids need much more specialized services. So that's another area we're going to be looking at. Residential resources, this focus will be more on foster care as opposed to staffed homes, because the story isn't illuminating the staffed home, it's illuminating issues around foster caring and the quality of care and how that gets monitored. There's a big issue around workforce on a whole bunch of different levels. So we'll be taking a look at, the recruitment, the onboarding, the professional development, the monitoring, the clinical supervision, and again, with one of the sidebar conversations about new workers, how do new workers get prepared to do the work in often very complex situations, and what kind of retention. There has been, just as an aside, an 11% loss over the last few years of the capacity in Ministry of Children and Family Development in terms of the child protection services. So that's a significant loss of staff. It's very, very hard to recruit. So we have to be mindful of that as we go forward, because that affects the capacity. It doesn't matter how, well-meaning workers are. If you just simply don't have people that can do the work, it makes it difficult. The story also illuminates how important interagency collaboration is. Education, health, MCFD, and policing in particular. So taking a look at that, what things get dropped, what things get picked up, the kinds of tensions between systems we're seeing rising again. When there are very few people retreat into their silos, and we're seeing challenges across many stories of that interagency collaboration. Family violence and the system's response, again, what we see, some of the patterns is the lack of systems response when there's intimate partner violence. We've kind of lost our way a bit, I think, there. At least we're wondering about that. And there's a lack of communication between policing, for example, and the ministry. So looking at this, Parental mental health and substance use. We do have many parents who struggle with mental health concerns and substance use. Does that mean that they can't parent or can't have some sort of involvement? Or does it mean that we need to have more specialized services and supports to help them be able to regain their parenting? That is getting illuminated here. And then there will be other things that will be guided by this children's story. I can say for sure COVID will show up here, and the kinds of capacity that was in place for COVID, but there will be other things undoubtedly as we begin the investigation. So you can see we're sort of doing the investigation, and already it's illuminated some systemic issues, and then we'll be working on these systemic issues at the same time as the investigation is going, but we'll make sure that we're sort of connecting the dots. And if there are other issues that are arising, then we will add them to the systemic review. So it's going to be quite the chapter book at the end of it. But again, centered on the children's stories. But sadly, these are not outlier situations. So we felt it was really important. And we look upon our effectiveness. And again, thank you, Norm, for making sure that we're holding ourselves accountable. We've done a lot of reports that are on specific issues, like substance use or mental health. But we actually, as a team, have not taken a step back and said, okay, from these children's experiences, what does this teach us about how the system works? And what kinds of changes need to Stop getting cut off? No. Take her off. So it's going to be new for us, and I'm very happy to kind of provide you with some things that as we go. But I think it's important, and I think that the ministry is actually, from what I understand thus far, recognize that this is going to be tricky, but at the same time, I think the ministries, in many cases, they're trying hard to deliver services, but the context is very, very difficult. Staff are trying hard. The context is very, very difficult. So I think it was timely for us to take a look at the broader system and see if there's something that we're missing that could affect the change that we all desire for our children, to keep them safe and to thrive. So I just wanted to give you a sense of that's the journey we're going to be on. I have made a commitment to complete this by June. Why June? Well, there's going to be a writ dropped at some point, and then it would take some time, obviously. So we wanted to make sure that it was in the hands of decision makers as they move forward. So it's a very ambitious timeline for us. We will be going to our Select Standing Committee for Finance and Government to ask for some additional resources. In the grand scheme of things, nominal compared to doing a public inquiry or having an external party. But we're going to give this we're going to give it our all over this next period of time, and it will mean that we will be putting some other things kind of off to the side for a little while in order to put all hands on deck to make sure that we complete the work that's underway already, but then also do justice to this going forward. So we will be completing by June of 2024. And as I say, it will be, we'll try and make it as accessible as possible, but it will be a significant piece of work, and we will have undoubtedly some incredible advisors. We've already reached out to a number of people, and I think people are excited to be able to contribute to the wisdom that's necessary for these really difficult situations that we're facing. So I welcome any kind of comments and questions, and then, as I say, I would certainly invite, if there are things that you think, could you pay attention to this as you're doing the review, we'll definitely take that into account in our planning.
Thank you very much. So do members have questions, comments? Over to you, Corinne.
Thank you very much. Thank you again, Jennifer, Pippa, Sam, for all the work that you do. Is this on? Oh, I'm on, okay. This is just a comment, and since I read about this horrible incident and learned more about it, it just really got me thinking about and you've talked about this in your previous reports, government becomes the parent, really has that responsibility of the parent when they remove a child from family or from a home. And that a decision can be made to remove a child from a home to put them in a place where they're even at more risk or more danger is still very troubling to me. And this is one incident that we've heard of, and as you say, you investigate when there's a death involved, but it worries me to see that that's part of the systemic review, I guess, but how often and what decisions can possibly be made by MCFD and social workers to allow a child to be in a place that is more risky than the family that they've pulled them away from. And, when children are taken, I'm going to ramble for a moment, when children are taken from their home is so very often because of poverty, because of, housing insecurity, these kinds of things. Rather than to remove a child, that ability to, as you've said, to provide those more resources to that family so that they can keep that family together is money much better spent and is much better for families in the long run. So anyways, a ramble comment, but it's just so disturbing to me that a young person, government can have that responsibility and they can actually put them in more harm than what they're taking them out of. So so thank you for the work that you're doing.
Thank you. And yeah, just to pick up on that, we code for what's called emotional harm injuries, and one facet of that are injuries that children sustain in placements, either staff placements or foster homes. And it is very disturbing. It's been growing. I think it's growing for a number of different reasons, but it is, that is absolutely the critical question. And so what this will allow us to take a look at, not only for these children, but also more generally, like, what were the factors being considered? What were the supports being provided to the parents? What were some of the things that were provided to the caregivers that were selected as well? Were the caregivers raising any concerns, and how were those being addressed? So there's a lot of nuances as well. So I think there's a number of things that will be illuminated here, but you're absolutely right. It just affects us, I think, at a different level when we think, okay, a child is being removed often because of poverty and neglect, or neglect associated with poverty, and then we're putting them in harm's way. So it's a huge consideration. I'm just seeing, okay. Pippa's just written me a little note. Thank you, Pippa.
I can talk, but
Why don't you go ahead?
Yes, you're on. Am I on? Okay. I wanted just to acknowledge something that Jennifer said about this being a full team lift at RCY, that this is going to be a really dedicated piece of work. And there's two really key people joining us online from our team back at RCY, John Yakalashik, who is the Executive Director of Reviews and Investigations, and Susan Preddy, who is also joining us, who is the Manager of Investigations, and both of them will be key, and potentially you'll be seeing them in the future if we're interacting around any comments, questions that you have. So just wanted to make sure that I brought their faces into the room for you.
Thank you.
thank you very much, and over to you, Doug.
Thank you, Chair. Thank you, Representative. I really like the idea of the hybrid investigation and linking what would essentially be almost anecdotal by itself, but as a real-world example and following that. Can you describe, as you've considered that, some of the challenges you foresee in managing those?
Yes. Thank you. It's one of the things that keeps me up at night. How will we do this? Well, one of the challenges, of course, is making sure that we coordinate the efforts. So what we've started to do is identify sort of a template, if you will, of how each one of these, just think of these as hubs or pods, in the systemic review. So we have kind of a consistent approach that will be taken for each one of those in terms of what is it that we need to understand about them, what's the data that we need to harvest from our data, from external, who are some of the experts in this area, what do we know about what young people's experiences are, et cetera. So essentially each hub will be kind of having a template and they will be working on that. And then we will be hiring or we'll be appointing a project coordinator that will essentially start to help, and a writer that will help start to knit the pieces so that there is some kind of thematic consistency going forward. I think the challenges that we'll face is that there's a lot of emotion attached to this. There's a lot of, and we've tried so hard, Doug, over the last number of years to try and help staff understand we are not here to see heads roll or to have gotcha moments. Staff are working in systems, and sometimes it's the systems that create the conditions where the staff can't do their best work. But the other challenge we will face is, will people trust us? So when we go out, will they be able to, whether that's the family or community members, decision makers, frontline staff, et cetera, will they be able to trust us in order to share with us the information that we really need to have? So we've talked quite a bit about how do you build sufficient trust in a short time so that people know that we actually have the best interests of children at heart, not trying to expose people to, you've screwed up. That's not our intention whatsoever. So I would say, and time is our challenge as well. So we're trying to figure out how to kind of systematize things as much as possible while also recognizing these are some of the difficulties that we're going to face. I think the other thing that we're very mindful of is how important it's going to be to get really good advisors and to keep First Nations Leadership Council, Métis Nation BC, and Indigenous Child and Family Service organizations aligned and supportive. So I do imagine that we'll be doing some convening as we get closer, basically saying, here's what we've learned. How do we make sense of this collectively? So we're not just kind of in the back room figuring it all out. I don't know if that answers your question, but.
Go ahead.
Yeah, I think that adds to the quality of the enterprise, that process that you described there. And if it works as you intend it, it should be very translatable to people and more real, I guess. But yeah, so it's going to be very interesting. Thank you.
I hope so, yeah. The other thing I should say too is that we're trying very hard to do this in a way around Indigenous methodologies as well, because this does concern an Indigenous child. Yeah. I think the systemic review will consider all children, but trying to make sure that we bring in Indigenous methodologies. And just as a little aside, we're actually doing some internal work on that. We've also invited like Tom Gove, people that were involved in the Hughes review back in 2006 to basically say, so how did you tackle, what were some of those things with 2020 hindsight that might be the barriers? Our executive director of communications and knowledge mobilization worked on In Plain Sight. So we're trying to figure out, like, how do we anticipate those barriers that you're talking about as well?
Awesome.
I think one of the other challenges, just when I listen to and recall the voices of FNLC when we were meeting with them around the importance of being able to be truth tellers in this process as well, and knowing that, like, one of the leaders in that group said, noticing quite a difference in a decline in workers being confident and feeling like they can go forward in community. His words exactly were, workers are becoming even more squeamish to approach family in community, to like hold the truth telling at a place where people can actually learn and change and grow, as opposed to just sweeping it under the rug. And so for us, I think one of our challenges will be, how do we remain independent but be good truth tellers and not be paternalistic in the way that we move forward and come up with potential recommendations.
Thank you.
Thank you to the whole team there, and Samantha, the Deputy Representative, Pippa, of course, we know you've been here many times as the Deputy Representative, and the two who are on our Zoom meeting with us, John Yashik and Susan Preddy. So thank you, and so to give you a 5-minute break this time, because let's take a 5-minute recess, and then we'll be back and do the last segment. and we're going to make all the big decisions while Mike is out of the room. No, 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 no. We will be receiving an update on the office's key performance indicators, and I already told them, Jennifer, that this is going to be the most scintillating part of the meeting. So joining us for this discussion are Dr. Jennifer Charlesworth, our representative for Children and Youth, Samantha Cocker, Deputy Representative, and Pippa Rowcliffe, Deputy Representative. So over to you.
Thank you very much, Chair. That's quite the setup. So I'll try not to, I'll tell you what's going to be scintillating about it is it's going to be actually quite brief. So you'll be able to get on with your day while it's still light out. So as you know, in our annual report and service plan, we identify a number of things that we measure as a way of determining whether we're doing the right thing and that we're having the impact that we desire. And as a result of some of the feedback from this committee and good questions, we took we've just been doing this by rote. They were developed quite some time ago by this committee in conjunction with a former representative. And when we started to take a look at it, we realized these are outputs. It doesn't tell you what is actually happening as a result. What does it mean to say we've got 1,500 advocacy cases? Is that good or not bad? We don't know. And it also doesn't reflect the kind of impact that we're having as a result of our existence and our 75 amazing people doing work every day. Does that change the needle on the dial for a child, for a family, for a community, for a service, or a ministry? So, as you know, we came back to this committee to kind of get some feedback on the kinds of things that we needed to pay attention to. So it is a work in progress. Where we're going right now is we took to heart that it is important to make sure that we've got some of those metrics, those output kinds of measures, things like how quickly do we respond when we get a call? How quickly do we review the reports that come in? And how present are we in communities? How many times are we going out into communities? How many young people have we reached through our engagement work? How many reports have we reviewed, et cetera, et cetera. So we will continue with the outputs, but our work now is very much on the immediate outcomes and then hopefully the longer term changes. So one of the things that we've decided to do, and you'll know from the annual report and service plans, that we talk about the annual report part, we talk about our 6 R's: relationship, respect, relevance, responsibility, reciprocity, and restore or repair. So we are working with those 6 R's to say, how do we line up our outputs and our outcomes? So for example, what would respect look like? Our teams have spent a lot of time thinking about what does respect actually look like and what could be measured. What does reciprocity actually look like? Good example would be, if we're out in community and we're gathering information from community, reciprocity would look like we don't just take, we actually give back. We validate, we make sure that they know and that there is that kind of relationship and that reciprocity of information. So we aren't the kind of the researcher that comes in and takes and doesn't give back. So we're trying to identify a number of those things working within the 6 R's. So basically we're for each one of those R's, we've got goals and objectives that Pippa has been working on. Thank you very much, Pippa. And we've identified typically about 3 outputs that would be measured for each one of those, and then identifying the outcomes. Clearly it will be, it's hard to measure longer term outcomes, but we're trying to figure out what would be reasonable proxies, probably one per 6 one for each of those 6 R's that we could all agree upon. So it's just to give you a progress report. We aren't quite as far along as we thought we would be or hoped to be, because these are, it's difficult to figure out how to measure outcomes when we don't control all the variables, but that's essentially where we're at. Is 6 R's, outputs, outcomes, typically about three of the metrics for outputs that you'd be seeing on an annual basis, and then one measure of outcome that starts to suggest whether we're actually making the difference that we want to make towards children being safe, belonged, and thriving. And that we're a part of that. We're making a contribution to it. I'm going to turn to Pippa. Anything else you'd like to add there?
Just to add that we've been actually, part of the reason why we've been slowed down a little is that we want to be quite robust in terms of how we're thinking about this conceptually. So ensuring that we are thoughtful about how we use some of the existing ways of thinking about understanding the outcomes that we may have, especially given, as Jennifer said, we're actually a small part of the change that we want to see, and we have a very specific role and intention. So wanting to honor that and make sure that we're clear about the things that we believe that we can effect change in, acknowledging that others have to be working with us to do that. The other thing that's been really important at the moment is thinking about where we might be able to build additional data sources, if you like, or ways to gather the information we need. And that's going to be requiring us to think a little bit differently and put some new structures in place to be able to do it. So the work is underway, and I think the thinking underneath it at the moment will actually support the intention behind it, and our desire also to know where are we having an effect and where are we not? Where are we getting those points of leverage? It's been hugely important, the work that Sam and Jennifer Dreyer have done around the Advocating for Change report, because that's really helping us understand where that signal out there on reports and recommendations is working. As Sam is building all of the work around our community youth engagement, that'll be another place where we can start to think about gathering voice from children and youth about what they see as the impact of our work, and we'll be rippling that out with others as well. So we've got all the pieces in place. The actual detail in terms of the black and white is still a work in progress.
So we expect that we'll have that back to you when we next meet in November, so that you can ratify it or modify it, and then that will move forward. And just to build on Pippa's comments, we are developing a data strategy as well to try and link our data a little bit more effectively. Also, this next year is also going to be, not only are we doing an experiment around our hybrid model, but we're also doing the convening that I mentioned on substance use, and with some of these really difficult issues, we think that that's one of the ways that we can actually achieve some of the outcomes is by, even though we're an independent office, we can convene, we can host, just as we did a Saturday ago with bringing 240 people together and with 82 youth to talk about how to improve access to justice. And then you can measure that. But that is, those are ways that we're thinking, well, maybe we can have more impact if it's not just us, but we build the circle stronger. So those would be some of the things we would be measuring.
Thank you very much to you and your team. And what really hit me is when you said, when you're dealing with outcomes, when you don't have total control over the inputs. Yeah. And as a teacher, I said that all my teaching life, right? All these people who want outcomes. And Mike, I want to remind you about that. And from when you were education minister, and when you, so I hear you, and I'm sure social workers, all kinds of workers are hearing what you said, and they'll be able to relate to that in a big way. But we really are looking forward to looking at your work in progress as it progresses along. So, Karen?
Thank you again. So if I can just confirm with the chair, I've got 2 hours to ask questions right now.
You can have the 2 hours, but you're sitting next to Mike.
Oh, okay. I'll make it shorter. It's really difficult to take qualitative measures and try and quantify them, and so I understand that that's a real challenge that you're going through at this point. But there are a lot of things that you can impact, but as an advocate, and I don't know if we call you a watchdog, but as an influencer, your mandate is to be able to make change in government or overseeing government. So as part of your measure of success, is it fair to look at some kind of metric? And I know you track these metrics in terms of you've made X number of recommendations and, you know, whatever percentage has actually been achieved by government. But is that also part of what you are looking at or need to look at?
Yes, great question. Yes, absolutely. And that kind of speaks to the relevance. What's our relevance? So we, as I've mentioned before, we've reimagined the way in which we do our monitoring. And we have quite a bit of discipline now attached to that. And we currently, or up till now, we have been receiving information from the ministry and adjudicating that as to whether we think that they've met, they're moving forward on the recommendations or not. Now we're actually we're trying to figure out the best way to kind of make that, going back to families, for example, or young people. Has that changed for them? So we are not just looking at what the ministries say. So that will certainly be, that's part of the qualitative that you will be talking about, that you've talked about, and that will be something we'll be taking a look at as well, as those are the proxies for whether things have changed or not. It's an interesting thing because, as you know, as teachers, like, you can kind of game the system. Like, we could do really easy recommendations, or we could, not scrutinize the data that we get or that kind of thing, and then it would make us look good, because it would be like, look at all these changes that we've had a hand in. But we recognize that almost nothing is easy. The easy stuff has been done. It's the hard stuff that lies ahead. So trying to recognize, giving everybody a little bit of grace here. But we do want to make sure that even if the news isn't great, like we haven't had the impact or the changes haven't happened, it's still important data. It's still important feedback to a system that says, gosh, like we did with advocating for change, it was like, wow, that's far fewer recs than we thought. But then it was like, oh, well, these recommendations actually move through very quickly. The ones that are hard are the ones we need to pay attention to, when there's got to be interministerial collaboration, when there's got to be consultation with First Nations rights and title holders, when they are dealing with things in which they're, housing insecurity or lack of housing affordability is actually one of those things that's creating the conditions in which we can't move forward. So that's important data too. Even when we fail to have the kind of effect that we want to have, if we measure it, it still keeps us accountable.
Great. Thank you very much. Thank you.
Thank you. Okay, thank you. And seeing no other questions, I want to thank you and your team for coming forward. Obviously, you were very, very clear in your presentations. And, but also, as I was saying earlier, some of these were process and works in progress. And I'm sure we will have far more questions when you bring them back to us. So thank you very much. And now I will turn to members for any other business. Norm?
Madam Chair, just so we don't lose the thought from before in the report, which was to ask for representatives from the Ministry of Indigenous Relations and Reconciliation and MCFD to come and talk about the discrepancy between supports. It doesn't fit in the motion that we passed today because it was part of the report, the annual report. Where might we bring it up? If not today, when in the future might it come up, so we don't lose the sight of this potential opportunity to bring a couple of ministers in and encourage them to make sure the discrepancies are filled?
Thank you, Norma. I already was having some discussions at the front here. We parked it on the side along with the other, and at a subsequent meeting, and we will talk about that. But in the meantime, we can let the ministers know that this question has come up and then follow up later, if that works for you. Okay. Yes.
Sorry. I just asked Sam, and we can provide to you when we anticipate the ministry will have done their annual reporting to us on At a Crossroads. It's due, so maybe we can provide that information to Karin, because that will influence perhaps some of the timing. We can provide a report back on what we've seen, progress or lack of progress.
Thank you. We look forward to getting that from you, and that will help us in the future. But seeing no other business now, I would like to see if there is anybody who would like to adjourn the meeting. Okay. Thank you. All in favor? All opposed? Great.